Good afternoon and welcome to Bariatric Friday. Today is September 1st, 2023. My name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau, our program director, co-founder of American Surgery Center. Our goal today is, as every week we do these events, provide resources for our patients who are going through pre or post bariatric surgery, and as well as those individuals who are struggling with morbid obesity. And our goal again is to be a additional resource for them. The best part of what I do in this, it's not something that I do on my own because it's a clinical presentation. And when we don't have the licensed people, the clinical advices are not same. So, I'm not going to do this without one of our surgeons with me. And that's why we always have someone from CHRIAS side to support our events. Dr. Irgau, thank you for being with us. How are you doing?
I'm doing great. Thank you for having me, Kemal. As always, it's a pleasure to be here for our Bariatric Friday session.
Thank you. So before we start with our topic, today we are going to discuss the resolution of comorbidities after bariatric surgery. And we have done so many different times we actually discuss this topic. So for those who are going through the program, if between several different visits that you have with surgeons, nutritionists, or the other specialists as part of our multidisciplinary approach, if you still have questions, these videos are posted in our playlist. Now, we made one update last week where we now have enough the same topic is being discussed 5 or 6 times average. So we put them in a single topic-specific playlist. So you can easily reach out to these videos, and because we are not going through a scripted anything scripted, so then every time we discuss these are going to be slightly different. The core is going to be the same, but we may have different updates related to the topic. So then it's good to watch most of these. Even if you watch one, you can still watch the others. Now, bariatric surgery is the most important tool and most effective tool, and then yet the utilization is not there. And one of our goals also is to increase the awareness of how effective this tool is. Now, when we say comorbidities, we are talking about other diseases comes with morbid obesity, because morbid obesity is never by itself. There are situations that may be some exceptions, but when people have morbid obesity, usually they have hypertension, hyperlipidemia, they have diabetes, they may have refluxes, heart disease, sleep apnea, so many other problems comes with. And when we took care of the issue of morbid obesity with the most effective way of which is bariatric surgery, now there's an amazing result that we see, the resolution of these comorbidities. So that's where we actually want to kind of focus on today. Now, Dr. Irgau.
Absolutely, Kemal. So it's obviously a very, very important topic. When we look at bariatric surgery, at what we do in our center, clearly and almost naturally, people focus us at the most obvious result of what we do, right? So people come very, very overweight with severe obesity. And once they've had the operation, sometime later, that weight is gone. So the most obvious, the most visible result of what we do is weight reduction, right? Somebody who was very overweight, and you could obviously see that in their appearance. Now they've lost 100 pounds, they've lost 120 pounds. They were going to be looking completely different. That's the most obvious and the most outwardly result of what we do, right? But clearly, what we do is way more than weight reduction, right? As we've said it time and time again, and that is improving the health of the person, right? In a tangible way. And that's what we're going to talk today about. Risk of many illnesses related with weight, with obesity actually decreases, or illnesses that have already developed in that person will go away as well. It is interesting, actually, the last patient I had today in my office hours, around 1:30, a person, who weighs about 285 pounds, and they would like ideally to be 150 based on their height. We were discussing weight loss surgery, the options, and they asked me whether their risk of diabetes will go up after they've had this surgery, right? I said, on the contrary. In fact, I want you to actually, if you have time, watch our session today on Bariatric Friday on YouTube, and I hope they are watching, because I said we will actually be discussing this very topic, what happens to certain illnesses related to obesity. So on the contrary, of course, rather than increasing the risk of diabetes after weight loss surgery, not only the risk of type 2 diabetes goes down, but also if a person already had type 2 diabetes, that is likely to go away or improve considerably. This is very important. It has really marked a shift in the interest of many doctors now referring their patients for bariatric surgery once they have discovered that it's not just about reducing the weight of the person, it's actually making them healthy as well, right? If you're a primary care doctor and you have a patient who is about 100 pounds, 150 pounds over their ideal body weight, they're going to come to you not only with the burden of that weight on their daily to-day life, but also with illnesses that are associated to it. So the likelihood of that person having type 2 diabetes is high. The likelihood of that person having high blood pressure is high. The likelihood of that person having sleep apnea is high. So as a primary care doctor, what would you be doing would be prescribing medication for each of those illnesses, right? Once you discover that actually those illnesses are closely related to the weight, then you will be going for bariatric surgery as the solution, right? Because once you address the weight, then you will be addressing those illnesses as well, right? And doctors really discovered this, Kemal, in a very clear manner when in 1995, there was a publication in the Annals of Surgery. That publication came from the University of East Carolina, and it was authored by Professor Walter Poirier and a team with him. And the title of that paper was actually much more unusual than most scientific papers. The title was, "Who would have thought it? ? An operation proves to be the most effective therapy for adult onset diabetes," which is another way of saying type 2 diabetes. And what they've done is, at that time, which is 1995, reported on a 14-year experience doing gastric bypass surgery. As you can imagine, in those days, gastric bypass was being done in an open fashion through a very big incision. And they were not doing all that many operations compared to our, the operations that are done now. In fact, over 14 years, they had 608 patients, which is the number of patients which probably we will do in a year and a half in our surgery center now. Anyway, what they've reported, Kemal, is that of those 608 patients, about 150 had type 2 diabetes when they came in for the surgery. And then when they followed them up after they improved recovered from surgery, of those 150 patients, about 121 had total resolution of their diabetes, 82% of them. And because type 2 diabetes was supposed to be a chronic illness that never goes away until then, but then they have proved that this operation, gastric bypass, actually can cure type 2 diabetes. And the main purpose of their paper was to show how type 2 diabetes could actually be cured with this operation, but also they listed a number of other conditions that these patients had alongside type 2 diabetes that also improved, including high blood pressure, including sleep apnea, including heart disease, sometimes congestive heart disease, arthritis, joint pain that these patients had, many women, young women who had infertility as they came in for the operation, their fertility level increased. So infertility was also being treated. And of course, since then, we have been able to reproduce these results with larger and larger study. And of course, we know from our own experience, when we see our patients coming in for bariatric surgery with all these medications for all these illnesses, once they have bariatric surgery and they start losing weight, we see improvement in these illnesses and is in the number of medications that they have to take. Now, these results, as you know, Kemal, are quite dramatic. In other words, you could have somebody who has type 2 diabetes and they could be on many diabetes medications, including insulin, right, before the surgery. And then within about 4 or 5 weeks, we would send them back to their endocrinologist or their primary care doctor because the medication is too strong for them. Now their sugar is dropping too much, and their primary care doctor would take them off insulin within about 4 or 5 weeks of the surgery. And we've seen in situations where, particularly after gastric bypass, you would see patients get off insulin even immediately after surgery. So the impact of this operation on these illnesses is very dramatic in manner that is probably unseen in medicine before this type of surgery. I mean, it's very hard to think about any operation, single operation, that in one stroke is able to remove so many illnesses from a person who's suffering from them. So resolution of comorbidities, improvement in health, really, although it's not the most visible aspect of bariatric surgery, in many ways, it's the most fundamental reason why we do this surgery to begin with.
So, Dr. Ergau, when there are 2 case conferences I do every day, one is the bariatric, the other one is the primary care. And in the primary care, the goal or the focus is different. On bariatric, our focus is morbid obesity. So what I have seen, like this is almost last 2 years. Just imagine, one of the medical schools, what makes you guys the great doctors, you repeat the same thing every day. But also every day while you are repeating the same thing, you are also seeing some variety and some new cases. And now you build up your experience and you become a great doctor, right? So on the doctor side of it, so it's almost like an education for us. So I have our nurses, our other business development team members, and we look at the patient from their chronic illnesses standpoint to see how this patient is being managed. Again, I'm on the primary care side. And for those patients who may have diabetes and hypertension and other problems, even if they're controlled, what we see is they're controlled with 3-4 different medications in each group. So all of a sudden you look at this patient, and I do kind of like, that I don't, panic easily. But when I see like 7-8 medications that patients taking for 2 disease groups, I'm thinking, well, there is a solution for this. And then usually we kind of tie that into the patient's BMI to see where the patient is. We are not saying that every patient with morbid obesity is going to have these issues, but most patients who have those illnesses do have morbid obesity, and they're almost on the borderline of being having morbid obesity and morbid obesity. So having 7-8 medications every day, multiple times, it's challenging, right? So you have to really go through this, and it's not the best way. These medications do have a lot of side effects. I think the worst side effect of the surgery is the excess skin for those who lost 150, 160 pounds, right? So, but that's okay. We have, we can figure that out. But this is when you live with those chronic illnesses for so many years, you only live so many years. So things are not happening after a certain time, and you actually end up your quality of life is decreasing, and your life actually is decreasing. So now when we look at the resolution, as you are highlighting, but I want to give some numbers. we are not talking about like 10% or 20% resolutions on these issues. When it comes to diabetes, we are talking about 83% of the patients who whose diabetes is resolved. With the cardiovascular disease, 82%. With sleep apnea, that anywhere from 74 to 98%. Hypertension is 72 to 94%. And these results are extremely impressive. And that's one thing that we want patients to understand. Again, like every time we discuss these, we know there are other issues, not just treating the clinical problem, but there are social stigma of it. There's other psychological impact of having this surgery. But main thing is knowing how effective this is the key. And now, if someone says, "Well, I don't have any of those problems, so what's next?" Well, you may not have those right now, but they're going to develop in time. But one of the biggest also issues is the joint problems, right? So like when you have to when you have to live with that weight for so many years, then your joint issues are going to come up. So then it's not like we are saying that you should only do this when you have these problems. We are just saying that those are the benefits of having the surgery, because the main issue of getting someone from 380 pounds to 200 pounds in 9 months, that's a huge impact in their life. So one of the things that I also want you to kind of elaborate for us is in some of our discussions this happened, the cancer, the impact on cancer, how the weight loss has impact on the cancer, if you can actually address that for us.
Absolutely. So really, with the increasing incidence of obesity in our society over the last 3-4 decades, especially, we have also seen an increase in a number of different cancers, right? We're thinking that our fight against cancer was having the upper hand because of improvements in detection, because of improvements in the treatments, and also because of the preventative work that was being done at a population level, whether it's mammograms or colonoscopy. Then at that time, we were also seeing an increase in the incidence of these conditions. And that seems to be related to the rise in obesity as well. In fact, there have been a number of publications come out that have really demonstrated that there is a correlation between certain levels of obesity and a number of cancers. And that number of cancers is actually growing, meaning that we are finding that many organs that are involved in a specific type of cancer, that risk actually increases with obesity as well. So when you look at studies that have followed up patients that have had surgery to reduce obesity and patients who have not had surgery and they remained obese or morbidly obese, you can see clearly that the incidence of cancer is much higher in those who did not have the surgery to reduce the weight. So there is now this association. Obviously, we don't understand clearly the mechanisms by which obesity puts a person at risk for the development of certain cancers, whether it's uterine, whether it's breast cancer, colon cancer, kidney cancer, right? But regardless of the mechanism, the data at the population level shows that obesity has a clear correlation with incidence of a number of cancers. And this is obviously very concerning, Kemal, because if you look at the cause of death in our society, you are really looking mainly at things like cardiovascular disease, like heart attacks, high blood pressure, and strokes. You are looking conditions like type 2 diabetes, and then you're looking at cancers. This really make up the majority of the causes of death in our society. And guess what? All of them seem to be correlated with the incidence of obesity as well, which means that if we are able to tackle obesity, we are able to reduce drastically the appearance of these illnesses and therefore have an impact on the longevity of our population as well. So that the life expectancy of the population will actually stay higher and continue to increase if we have an impact on obesity. Unfortunately, we see as you know, Kemal, even though bariatric surgery is the most effective treatment that we currently have for severe obesity, it is accessed only by a very small minority of patients. In other words, the people who end up having bariatric surgery are a tiny fraction of those who would be eligible for bariatric surgery, which means that we're not really reaching the largest number of people who need our help, which is that we may not have impact on this life expectancy. And for the first time in our history, we may have a generation that lives shorter than its previous generation. In other words, the life expectancy over the decades has been increasing steadily because of improvement in health. But for the first time, this generation actually may die earlier than their parents because obesity is making all these illnesses appear and cause early death in the population, essentially. So you're absolutely right. It's not just about the comorbidities that we're talking about, the type 2 diabetes, the high blood pressure, the sleep apnea, but also the appearance of cancers. And that is obviously of great concern.
You know, the other issue that many people also maybe not seeing this as a main problem when we discuss the morbid obesity is the depression and anxiety related mental health related issues. So mental health is one of the biggest issues in the society that we live in today. And yet there's not much we can do other than medicating people or even for the therapy, not enough providers available out there, or not everyone feels comfortable going to those sources. And what we see in our patient population with those who are dealing with morbid obesity is depression rate is so high. I mean, it kind of actually makes sense why they would, because there's a lot of body shaming, society, pressure. And I'll give you a funny example. And I sometimes share my ups and downs with my weight issues. But the other day, my dad told me that I have to lose 35 pounds. I'm like, what? Like, I thought I already lost, some. And he really just bluntly just said that you need to lose at least 35 pounds. I'm like, the way he said it was rough, tough, but you have to kind of take it. So like then that day, actually, when we were at the surgery center, I went to the scale there, and I'm like, let me see if he was right. You know how we lie about our weights all the time, and we discuss, and then I'm going to make a correction from our last week's event. So when President Trump reported his self-reported his weight at 215, he's not less than 280. No way. So, but my dad was right. So the scale doesn't lie. So then all of a sudden, I had this, like, I panicked a little bit because I was doing really well with my diet and walking and everything, but it's a slow process. So slow process in a way that I can afford going through that process because my BMI was never over 30. And where I'm comfortable is usually 27. And I can get to that if my dad keeps reminding me how much I need to lose. Yeah. But when we discuss, because our patients are not in the same situation, they have to lose 150 pounds. How do you do that, right? So now that's the depression part. I understand very well because it's depressing when even just hearing it. When he told me 35 pounds, I'm like, oh my God. Like, and then when I went on scale, I'm like, I was even more upset because he was right. So this is if I have to live with this for so long, then depression is going to build in a way that because it's not going to be limited to that. It's going to be affecting my interactions in society, like whether I want to socialize with others, I want to go out, self-esteem, everything else is going to be, and all of a sudden you have that chronic depression where, again, if we take care of if we go to the root of the problem, we can actually see so many great results on different illnesses that morbid obesity is related to. So, Dr. Ergau, I want to actually give a couple updates from our social. On our social media. On Facebook, we have a bariatric support group. This is a private group, so you have to be a member of CHRIAS. So you have to be a CHRIAS patient. So there's no promotion, there's nothing. So this is just for patients to interact with each other.
Yep.
And one of the things that I see, and I have given updates in the past. So someone lost 80 pounds. And then they're posting saying that I have 3 more pounds to be at 200. So this is from June 5th in 2 weeks. I mean, 2 months.
Yeah.
The other person is saying that I lost almost 100 pounds. Last time I lost this much, it was 25 years ago. No kids, gym 2-3 times a day, motivated for a job, etc. This tool has been a lifesaver. So these are, again, we are not asking them to put these. We are actually, the reason we have this is so they can actually discuss their issues. But I think related to the, resolution of the issues, when I see how happy they are with their results and then they want to share that, it tells you that this was a big problem for them for a long time. So one thing that I want to ask you, like, this is kind of interesting, and I'm going to put maybe one session for us to discuss some of these questions outside of our regular support group session. What do you do if your spouse is not supportive during going through the surgery process? I know it's kind of on the spot, but so this is one of the questions that, and I know they're probably watching right now anyway.
So it's actually more common than we think now, right? This issue, it is. Obviously, it's complex in terms of, trying to understand it, to reason about it, but it does happen commonly enough. So ideally, of course, what we want, Kemal, is that patients should try as much as possible to engage and involve their loved ones in this process, right? So for instance, it's not uncommon for me to see patients coming for the consultation and just expressing they wish they had brought their loved one with them as well, so they could also see this, right? Particularly if their loved one is somebody who's not struggling with weight, it is very hard for them to really understand the benefit of bariatric surgery, because from their point of view, if they're not struggling with weight, they will just say it's the person's fault, it's willpower, and all those things that we hear all the time that are associated with the stigmatization of obesity in our society, essentially, right? So if they are able to bring them in the consultation, if they are able to bring them during the various sessions that they will have, whether it's a support group or a consultation with a nutritionist or the psychologist, then that will be an opportunity for their loved one to be educated about this as well, right? So once the right education, the right reasons are given, people may actually look at it differently and support their loved one in this sense, right? But obviously beyond that, there could be issues of insecurity as well, Kemal, right? I mean, people may become insecure if their loved one suddenly becomes successful and improving their image because they've lost weight, because they look more attractive, right? And these points could create, obviously, attrition within the relationship, right? If that is a possibility, then one reason why we have people going for a psychological evaluation is also to explore these issues and be able to hash out possible strategies to address this. So yes, ultimately, if their loved one will absolutely deny them any support, that person has to make a choice about what is important in their life, right? I mean, you do want somebody in your life to support you when you're trying to become healthy, right?
So that would be the resolution of a divorce, right? So it's liable to this.
Yeah, of course. Of course, the issue really, Kemal, is that if you are in a situation where someone is not willing to even entertain options for treatment at something that you are struggling so profoundly, then obviously there are concerns about the validity of your relationship as well. But I do think that there are many ways really to address this situation in the first place, because very often it may just be lack of education and lack of understanding of importance of weight loss in the health of a person, and also at the critical importance of bariatric surgery in addressing this issue effectively.
So there's one of the line questions that I'm going to take, Dr. Irgau. One of the people is asking, what about gaining the weight back after you losing it? So that's one of the, I guess, fears that people have. Like we discussed, we focus on this topic of the resolution, but at the same time, some people are worried about, well, I'm going to lose it, but maybe 10 months later, I'm going to gain it back. So surgery versus not surgery, chance of gaining the weight that we lost, gaining that weight back, what would you say?
So the first important reality check that we have to put forward, Kemal, is that yes, it is possible to regain weight even after bariatric surgery. A famous surgeon who was really one of the founders of bariatric surgery in this country used to say in our conferences when we used to go, in the early days, he used to say that you can out-eat any bariatric operation, which means that you can defeat a bariatric operation if you're determined to do so. And why is that? And the reason for that is because obesity is such a biologically entrenched disease, Kemal. That's why we're doing surgery, because it is so hard to lose it. And the reason is basically because once the body decides that a set point of weight is the weight of the person, it involves different complex mechanisms to defend that. And we've talked about this in the past, bringing an analogy, for instance, between a thermostat in your house and how weight is protected by our body, right? If you put a thermostat and you decide the temperature in the house should be 69 degrees, for instance, Kemal, well, if it becomes very hot outside, well, the thermostat will make sure the air conditioning system kicks in to cool the house, right? So no matter how hot it is outside, you will be able to maintain that temperature provided your air conditioner is working, right? Similarly, if it's very cold outside, the thermostat will kick the boiler, in the house to get heating going on so that the temperature. Similarly, in our body, there are mechanisms to really look at the weight of the person and then decide that at a certain stage of the life of that person, a certain weight should be defended, right? There are complex reasons for why this is, but this is reality. So once a person gets to a weight of, let's say, 280 pounds, when their ideal body weight should be 150, it will be extremely hard for them to try to come down, because every time they try, whether with diet, with exercise, the body will just work its way through very subtle mechanisms to increase their caloric intake and decrease their energy expenditure, so that weight never budges beyond a certain point. So they're 280, they try very hard, they may go down to 270, 265, but they cannot go any way down, right? Which means that the body has ways to defend a certain weight. With that biology in the background, even after having bariatric surgery and lost that much weight, if you lose focus, meaning that if you don't stay active physically, if you continue to eat cheap calories, right, whether it's in drinks or in sweets, in an ongoing basis, little by little, the weight will accumulate, Kemal. It will accumulate and also sometimes even reach the previous weight or even surpass it. And people will say, how is that possible when you have such a small stomach? Well, it is possible because the biology that drives obesity doesn't go away by itself when you do the surgery. What you're doing with the surgery is you're tricking the body into thinking that the set point has been lowered, right? But you can do that so much, Kemal. So let's say somebody has surgery, Kemal, they've lost 100 pounds, and they were focused, they were active, but now they forget all that. A year to 2 years later, now they're on a sedentary job, they're sitting at their desk all day long, and guess what? There is a big jar of M&M on their desk, and all they do is just eat that all day long. Well, that's a lot of calories when you accumulate that, Kemal, right? And on top of that, if they start drinking calories, whether it's juices, sodas, or alcohol, then there is no really way to shield them from that, right? So yes, it can come back, but obviously the reason we also say that bariatric patients are patients for life for us is because we want to help them if situations like that arise.
Now, we also want we're gonna actually get to that point first, right? We have to lose the weight to see whether or not we're going to gain it back. It's a concern, but it's a concern of maybe some later time where I'm actually reading some of the patient posts 150 pounds. Give and take, I'm 220 pounds after that. So losing 150 pounds, for me to kind of relate to that is not easy.
No.
So we're not talking about, again, someone is losing 12 pounds before they go for some wedding in somewhere. This is not that type of issue that we are discussing. This is a big, very problematic, very challenging issue. So that's if we are able to get that person down by 120, then during that time, pre-surgical and post-surgical, we also have this multidisciplinary program in place that actually teaches us so many different new habits and also supports us during that process. So I know that our patients' behavior do change from the time that they start from the first consult to the time that their first year follow-up. That's not the same patient anymore.
Right, absolutely.
Those patients understand that what they went through is important, what they were given, that they received and processed. Now they know better and they can follow the instructions in a better way. But again, we are talking about so many different problems, so many different issues. We are talking about quality of life. Every time we try to see a family member, friends, loved ones, when you think about if they can live longer with good quality of life with you, is the key for this session. This topic is we need to make these individuals healthier, and the healthier is possible with the right tool, effective tool, and bariatric surgery is the by far the most efficient tool. So there is no reason, especially in our program, the way that we process everything, the screening process we go through. Again, when I won't shy away from repeating the same thing. We do case conferences every day. Every patient is being discussed every week in the process. So we may for us to memorize patient names and knowing what that patient had, what issue they had from last week. That happens just because we repeat this every day, and that's for the patient safety. And because we safely do these, just imagine you go home in 6 to 8 hours after your surgery. So that's kind of sometimes people really don't believe this, but this is statistics. 400 patients, they go home same day. So this is not that complicated from that point. So because of that, looking at the results and statistics, this is the best way you can actually fight morbid obesity. So take your chances. Don't take a chance, actually. Make a good decision. Go with the right program. Go with the most experienced surgeons. Go with the most experienced nurses. We can comfortably say our nurses at American Surgery Center are the most knowledgeable in bariatric surgery, just because that's what they do all day, every day. The surgeons are given, I'm not going to repeat that again, but from the staffing standpoint, not knowing the facility have the right people on that day, that's a chance. But in United Medical and American Surgery Center, when you are at American Surgery Center, you are not taking a chance because that's the right place for this procedure. So we want to help more people. So watch these events, follow up with your surgeon visits and others, and make sure that you go through the process and finish the process, and you can see the great results, hopefully.
Absolutely.
All right. Well, thank you so much for joining me, and we'll be back next week.
Thank you.
So we'll see you soon. Bye-bye.
Have a nice weekend. Bye-bye.